We welcome in our first guest on the program out of the 93rd Delegate, Michael Hornby. He is working his way up into the leadership in the House of Delegates. Didn't take him long, but he's climbed up to the point where you don't do anything in Charleston without going through Mr. Hornby. That's the deal right now.
Good morning, Rob. I don't know about that.
And that doesn't even involve the legislature. Just any place in Charleston.
Whatever you need. Yeah. Hey, Mike, how you been, man?
I've been good. Very, very busy. Much busier than the last two sessions. Let's just put it that way.
You are the caucus chair. You are also the vice chair of Educational Choice. And lots more going on there, too. So, Mike, we're not too far into this legislative session. This time last year, it was pretty much dead. You guys really went in a whole lot of news. But there's certainly a lot more going on right now, and vaccinations being one of those. How much of that has gone over to the House at this time?
So I think we will be hearing the first hearing on Monday for vaccinations. That same day will be actually in the Health Committee. They'll be voting on the CON, saying we have the first hearing this evening or this afternoon on CON. I don't know what the Health Committee is going to do. I'm hearing, obviously, it's the talk of the hallways down here. We're hearing carve-outs are a possibility. I don't know specific details on that yet, and we'll see what the Health Committee comes out with for the full body to vote for.
Yeah, in the next segment, we'll be talking with David Goldberg, who's the president and CEO of Mon Health and the vice president of Vandalia Health. He'll be talking to us about certificate of need. We talked to Amy Orndorff earlier this week about certificate of need as well. I didn't even know that Berkeley Senior Services also was interested in preserving certificate of need, because there's a specific item of care that they provide that's covered by CON. When you deal with carve-outs, is Berkeley Senior Services also one of those senior centers going to be a carve-out?
So I'm hearing rumors from carving out home health care, carving out IDD, carving out hospice, carving out the moratorium on beds. Again, I'm not in that committee, but we hear rumors, and I'm pretty well connected. We'll see how that committee goes. I think the committee is still pretty split, in my opinion. I don't think there's any guarantee that it can make it through health, and I think it's going to be a close vote. I do think it's going to be very, very close.
What would be the rationale for having carve-outs?
Well, as I said, I'm not in that committee, but that's what people are asking. If you're going to carve out, what's the point of repealing CON?
Right, like it's either certificate needs or bad, and they're picking winners and losers but we're going to pick winners and losers with carve-outs. Seems kind of inconsistent.
Yeah, I think that's what delegates are asking themselves. And it's one of those things that I believe the Health Committee is going to go long into the night tonight.
Are you hearing from healthcare professionals, hospital managers? I guess we'll be talking to one here in the next half hour. Are they in unison against the elimination, I guess, or in favor of certificates of need?
Yeah, so, the hallways are filled with healthcare professionals, CEOs from hospitals. There are some healthcare hospital folks that are for the repeal because they want to expand their care in their area. But the hallways have been full on the House side with lobbyists from both sides.
And is the argument in favor of certificate of need or the argument against the repeal, does it go farther than we want to preserve? We don't want the competition?
No, I don't think that's the argument at all. You have to look at the payer mix in West Virginia, and I ask myself, and I ask other legislators. I don't think a state has ever repealed CON that has a 75 to 82% payer mix like we do. PEIA, Medicare, and Medicaid make up for 75 to 82%, depending on the region that you're in, of payers, and we all know that those payers don't cover the cost of the hospital. So a full repeal of CON, in my opinion, could have devastating effects on our hospitals, and they could decide not to take PEI. And the argument on the other side is, oh, well, it's going to open up business and we're going to have competition. But we just don't know. Nobody else is like West Virginia. They do cite Montana and Wyoming. Well, those states are very, very different to West Virginia and don't have the issues that we have. So it's going to be interesting to see what comes out of health. And I'm definitely going to be listening all night tonight to try and inform myself. When it comes down to the floor, we're going to have hard decisions to make, and people are going to have to decide.
Is that the committee that Mike Height's vice chair of?
That is the committee that Mike Height is vice chair of, yes, sir.
So is there a possibility it doesn't come out of health and it just dies in committee, Mike?
There is always that possibility, Rob. I can't speak for those members, but I know it's pretty divided in that committee room.
How much of the governor's will influence whether or not this bill gets passed? Obviously, this is a priority of Governor Morrissey.
Well, that's the reason we're running it so early. It's a priority in health. The governor is working hard. I was over at the mansion the other night. We discussed this. We didn't discuss it in detail, but it is one of his priorities, as well as the vaccine. So that's why the Senate ran that early. So we are doing the due diligence that we do as elected officials.
And we talk about CON, we always get focused and bogged down with the talk about health care. But there's also certificates of need for taxis and towing services, the 3 Ts, and trash.
Those aren't being brought up at all. But it's just the healthcare CON that they're addressing.
So, if the bill were to pass and CONs are done away with, would that affect taxis and trash? And
no, this bill has nothing to do with taxis or trash or the PSC or anything like that, or the other various agencies or issues that have CON.
You see, because I think that's the low-hanging fruit and the most offensive part of certificates of need. It's not. There's so many potential consequences for healthcare issues, but to tell somebody can't start their taxi service, the taxi regions are protected, seems really anti-competitive to me.
I tend to agree with you, John. It just when it comes to trash, it's kind of a different story in the rest of the state. Not so much.
That's more of a utility.
Yeah.
And so is taxis in a sense.
You're talking about a carve-out and picking winners and losers on carve-outs for healthcare CON repeal or preservation, but by only taking on one part of CON, is that not picking a winner or a loser overall with certificate of need? I mean, why is it protected for the vast majority of those who fall under certificate of need versus healthcare?
Well, that's exactly what I would ask if I was in that committee and discussing it. I would say, if CON is so bad, we need to remove it from the whole thing. There are some folks here that say, if you're going to carve out, I'm going to change my vote because it's either all or nothing. So there's many factors to consider.
So at the very time that we're about to trigger an increase in measles and smallpox.
Let's get on to vaccination, Mike, because you grew up in Zimbabwe where vaccination rates are not what they are in the United States. You've seen some things firsthand while your fellow legislators seem pretty much on a course of repealing the vaccination mandates in the state.
Yeah, I mean, as a Rotarian who's been around the world promoting the polio vaccine, I can't get there. I understand where legislators are coming from, that you have the government shouldn't tell you what to put in your body. I just have a very different take on this. I've seen third world countries. They are actually in better shape than we are because they're still mandated in most of the world when you've done that. But I understand where legislation is coming from. I'm just on the different side of them. It's overwhelmingly popular in the House. I think that bill will pass. I'm a no on it, but that's for my reasons, and I plan to maybe address the public, and hopefully this doesn't change what people do. and they continue to take the vaccines that, the measles, mumps, rubella, and polio.
It was this date, 1905, the Supreme Court upheld the constitutionality of Massachusetts' mandatory smallpox vaccination program in Jacobson versus Massachusetts. That was 120 years ago today. Matt, you're about to ask?
Yeah, I know. I saw where there was an amendment proposed. I guess it was in the committee in the Senate. Hadn't went to the full House or full body, where they would exclude private schools from allowing exemptions based on their religious beliefs.
That got shot down.
Yeah. Could that revive itself?
I don't know, Matt. I think there are a lot of ideas out there. I mean, if you choose not to vaccinate your children, and let's say you get polio, should the insurance company cover you, or cover your child if you've got polio and you've got a disease and effects that last for the rest of your life? But there's lots of questions that you can have about this. I think the body here it'll be in the 58 to 68%, in my opinion, that it will pass as it is.
Well, it passed last year, so
it did.
Governor vetoed it.
Yeah, and so how much has changed from last year to this year for it to pass?
Last year, the Senate changed it to be just virtual schools and private schools, and the governor vetoed it. This is a complete exemption for religious and I forget the other word that they use.
Philosophical
thing, and that's what came through the Senate. I think it'll go through Health pretty easily, and then we'll see what happens on the floor. I think it'll be closer than last year because this is much broader, but I still think it passes.
What? So if then Governor Justice would have signed it, do you think that this would have came back this year? Because
Yes.
It's coming back regardless?
Yeah.
Okay.
Is there a parade, or has there been a parade of medical professionals that have had an opportunity to speak to the health committee to say whether this is a good or bad idea?
Absolutely.
And are any of them saying that this is a good idea to do exemptions? Anybody there says that any medical professional has said that we should not have mandatory?
Well, we haven't had our committee meeting. It's only getting to the House on. It'll be our first hearing on Monday, so we'll hear from both sides on Monday. But yes, there are plenty of people on both sides of that equation. John.
Medical professionals. Because I have
professionals.
Okay.
Yes.
I just have a hard time imagining any medical professional saying that vaccines are a bad idea.
Well, there's a very prominent one at WVU who, for the longest time, has said that vaccination should be a choice between a parent and their child. It should not be mandatory. And there are obviously many people in the House of Delegates and the Senate who believe that as well. And I assume they believe that because there is a passionate base in their own constituency that has urged them to take that stand. Because we all know you folks, generally speaking, don't go against what your district wants you to do. The majority of the people in your
generally
district.
speaking, I would say, and when it comes to the 93rd, it's not something that's been brought up a lot. I don't get a lot of, hey, get rid of this, get rid of that. We're kind of more moderate, but I understand when people present evidence that says, XYZ state has not had this in 20 years and they haven't had any issues except for sporadic pop-ups here, and our hygiene is much better than it was. I get it. It's just I'm coming from a different place. I've seen it firsthand. I'm vaccinated. My kids are vaccinated, so it's not going to affect me. But so it's one of those things where I just have to stand with my principles and what I believe in.
Yeah, this is where my head really starts to explode on this because I don't really understand the science, to be honest with you. I think I do, but I don't. When my great-grandparents, or however many greats it was, first came here from Ireland, they came to Ellis Island. At Ellis Island, you go through the medical screening, such as it was, and if people were sick, they were sent back. So everybody who actually, all the immigrants who mingled with the Americans, at least arrived healthy, or now, or at least they were screened. Now we've got this flood of millions of not just undocumented. I mean, they're just flooding in through porous borders, and we know that polio is endemic in both Afghanistan and Pakistan. We know that we've got measles outbreaks along the southern border in Texas and New Mexico or Arizona, I forget which. Just the timing of this seems bizarre to me.
Well, I mean, the timing, it was the governor's, he had it was one of his priorities, and the House has been working on this for a number of years. It's one of those things where I still feel we're a plane ride away from an outbreak, but some don't, and we're just, it is what it is. At this point, it's a battle I'm not going to die on. I mean, I'll vote no, but I'm going to be it is what it is.
Yeah.
Yeah, I think that in the United States, the country, the population has been a victim of the success of the vaccinations. So as a result, it doesn't look like a present danger. So out of mind, out of sight, right?
Yep, I agree with that.
Yeah, we've done a pretty good job of stamping these things out, and as a result, we've relaxed a little bit on it. We shouldn't, but we have. What else are you working on there, Mike, besides those two big items?
Well, I'm working on a laundry list of Matt Harvey bills. Thank you. I am in judiciary, so I managed to introduce all of Matt Harvey's suggestions for me, and I think we're going to make some roads there. I think we've got some support from a lot of people on those maps, so
great.
Hopefully we can get to some wins this year. And
can you put some meat on that skeleton?
What's that?
Can you put some meat on that skeleton, what these bills are about?
Oh, well, they're from increasing the sentence for murder. I've got...
That will make the prosecutors very happy.
Yeah. I'm trying to look through...
Negligent homicide. That was my number one on my list.
Negligent homicide. You've got, I think,
increasing the penalties for that.
Bills on that. Yeah. Fleeing, relating to fleeing from a DUI.
That's a technical cleanup. That would.
Yep. So we got a number of those that were also relating to residents for bail. We're doing one on that where the judge can take into account the status of your residence, whether you live in state or whether you're a legal resident when they're setting bail. So we got a number of those. I've got a number of what I call freedom bills for urban agriculture. I do have a lot of bills dealing with education, education reform. So auditing school boards, things like that, changing the date of the election for BOEs to the general election, even though, they can still take office the following July. It gives them, 6 months to sit in meetings and get trained and get used to the system. So it's not just, you get elected and then next month you're suddenly on the BOE. It's a lot. We have a $290 million budget in Berkeley County. So I think there needs to be some time before you take office so you can really understand that budget and how things work. We have a bill giving the superintendent the authority to fire within his administration or within that administration building. They are, at-will workers, and he should be able to let go anybody he chooses.
Hey, that's interesting. So is that because there's either a real or perceived bloat at the administration office for boards of educations?
Yeah, it's not as easy as hey, somebody's not performing and they're not doing their job and we need to remove them. The process to do that is extremely difficult. It's something I've spoken with our local Board of Education elected officials with, as well as the superintendent.
Hey, Mike, What is the woke words bill? I've seen that float across the Facebook feed.
So that short title is a little misleading and kind of was an attention grabber. But in government, there is chest feeding as opposed to breastfeeding. They can't mention the men or women. They have to. So that bill just simply says, women, when in government text and in the code, we're allowed to say men or woman,
as opposed to people with prostates.
Breastfeeding. Yeah.
Well, I don't have a prostate.
Yeah.
That doesn't make me a woman.
Oh.
So, I got a couple of comments about that bill. I went back and read it, and quite honestly, I thought there's nothing wrong with it. I'm proud to be on that bill. That's Kathy Cross's bill.
Oh, my gosh. Listen, if you see Jason Barrett down there, make sure he's wearing a seatbelt.
Yeah, I totally disagree with Jason. I don't need my insurance going up because you don't want to wear a helmet or wear a seatbelt.
Yeah, I think doctors don't want to be wasting their time doing things that they should have been avoided having to do by just a little bit of preventative measure, like wearing a helmet, like wearing a seatbelt.
I rode around in the back of a pickup truck when I was a kid.
Yeah, I did too. I mean, that was just kind of the way things were back then.
And
Stand
so
up
did
to
my
it.
cousin who fell out of that pickup truck and lost his life.
Yeah,
So,
that's right. You roll the dice, right?
yep.
The fire department used to call motorcyclists organ donors, and the helmets were brain buckets.
Yeah.
So,
Michael, thank you very much for your time this morning. Final word is yours if you
Hey,
need it or
thanks.
want it.
No, thank you guys. It's been a very exciting session. I'm looking forward to getting really into it next week when it picks up. We're still a little slow right now, but the fireworks are coming.
Much appreciated, sir. Have a good day.
Thanks, guys.
Delegate Michael Hornby,